Iowa's News Now reporter Faven Zodu is live in studio tonight with how healthcare professionals in rural Iowa are trying to make things work, even when the government's not working for them or their patients.
Mitch, right now, healthcare professionals tell me they're concerned by the absence of data collection, especially since we're currently in the respiratory virus season, and they say if the shutdown continues, this will eventually lead to a public health crisis.
Just kind of almost like trying to provide information to our patients in a vacuum.
Almost a month into the shutdown, and healthcare professionals are now dealing with gaps in data. Denise Gipple has worked in the public health field for more than 2 decades. While the lack of data makes work a challenge, she's also concerned about the human impact.
Who then aren't able to take care of their health as well, which then translate into more expensive health care when they actually do have to kind of bite the bullet and come to the ER. So it's very difficult choices that I think Iowans and anyone across the country is going to have to face.
And Tom Benzoni, an emergency medical physician in central Iowa, says there are multiple questions that will need an answer, especially if this shutdown runs for a long time.
Once the hospital is run through its emergency fund, they're supposed to come to work for free? I don't think so. They're not a volunteer. So, and if the nurse does come to work for free, how does the nurse pay for the gasoline to get there? I mean, these things roll forward.
Benzoni has been working in the field of medicine for more than 30 years, including during the previous government shutdown. He says there are large implications with this shutdown for rural areas.
If I drove through a small rural town, I was subject to whatever that small rural town could afford me if I was in a crash. So I think all Iowans, in fact, all Americans, but all Iowans need to think about, if you travel through some place that is outside of your domicile or your own township, you better be concerned about the healthcare that's available in that community.
And Gipple says the longer the shutdown goes on, the more we will see it impact all areas of a person's life.
We also know that staying healthy is dependent on proper nutrition. So if we're heading into respiratory season and we have folks who maybe aren't eating as healthy as they can because they can't afford to, we could possibly see more illness.
The CDC still has some information up on their website regarding this cold and flu season, based on the information collected previously. But some of that data was last updated on September 26th. Live in studio, Faven Zodu, Iowa's News Now.